So let's go right now. Okay.
Neck. I was here before. By the way, there was a single ball on this side. But now, yes, after that. And here, the layering has occurred. There was a solid film channel, so let's go with the neck. The patient has here. Well, here we have the strap muscles of the neck and head, but they are not here because if you look, it protrudes like a bone. The muscles have turned into bone. Here completely. Here are the suboccipital muscles, but more or less normal. And here are the strap muscles and the muscle that raises the scapula. Right? You feel it. Right. And here is a trigger point. We'll show the trigger point, but it is encased in fibrosis. So there is such a protrusion here. This is no longer muscle. This is already degradation of muscle tissue. It turns into bone. And here are bones too. Here are the trigger points. Right. Does it hurt here too? No. The main area is right here. The neck muscles, strap muscles, head, neck, the muscles that raise the scapula. They have merged, so to speak. They have fused together and formed one large lump, more resembling bone. And this can only be treated with therapeutic massage and myokinesiology. Instead of neck muscles, there were mostly bone cartilage structures here. As a single shell, there are already previous videos where I draw a sphere here, showing how hard the fibrosis crunches. Now it is no longer a single structure. This indicates that the outflow has improved significantly. Before, it was like a rigid, unyielding shell. This condition is known as myofibrosis, which is a type of fibrosis affecting the muscle tissue. Myofibrosis is a complicated stage of myofascial syndrome of the painful muscle. The muscles and fascia begin to strengthen, becoming harder, denser, in order to isolate the pain focus and the main one. And here the patient had a single monolith. Now it is much better, much better. So before it was as if there was concrete here, but now there are tissues. First of all, there was a break. The main process of recovery and healing occurs between procedures when the immune system suppresses inflammation and damage in these areas. If everything is done correctly, with proper nutrition and monitoring of nutrients, the process of forming healthy tissues occurs, resorption takes place, and the production of new muscle tissues is initiated. Yes, there is much less fibrosis here now. But what pleases me the most from this side is that if you pay attention to the video earlier, there was a protruding ball like this I filmed. I even marked it with a marker. Now it is, well, it exists, but it's about half as much compared to the previous video, and it has decreased here. And we are on the right path, because otherwise the fibrosis would only become harder. Muscles replace the bone cartilage structure here in the neck. Here we have the vertebral vein and the vertebral artery. The artery nourishes the brain, while the used venous blood with the metabolic waste from the brain flows away through the vertebral vein. Then there are the small capillaries. 80% of the circulation in our body consists of small capillaries and small vessels. The vessels are located in the tissues. The tissues are rigid. Accordingly, the capillaries are compressed and circulation, gas exchange, and the functioning of the lymphatic system are impaired. Accordingly, if we had not started therapeutic deep tissue massage in this area on time, a bone cartilage structure would have formed here. Vertebral vein would have been compressed. I don't know how many percent the blood outflow would have decreased. And this could lead to an increase in intracranial pressure. Why? Because the blood flowing through the artery to the brain carries oxygen and nutrients, and the artery cannot be compressed, as the artery itself is a muscle that contracts and relaxes. But the vein, which indeed runs parallel to the artery and drains deoxygenated venous blood, is not a muscle and can be compressed. And it was compressed by such fibrotic rigid structures. Accordingly, if these fibrotic non-muscles, compress the vein by, say, 20%, then the brain will signal the artery to contract by 20% and reduce blood supply to the brain by 20% in order to balance outflow and inflow. This will lead to hypoxia, oxygen starvation, nutrient starvation, protein starvation, nutrient starvation, and mineral starvation of the brain, neurons, and cells. This is called hypoxia, and if the formation of this problem is not stopped in time, it can only be halted by applying deep tissue therapeutic massage, because the main task, wherever the fibrosis is located, whether in the neck, lower back, thoracic region, or abdominal muscles, is to break it down. It needs to be gradually destroyed, procedure by procedure, like a sculptor who takes a block of stone and chisels away all the unnecessary parts to create a sculpture. The same applies here. To free the compressed vein so that the artery can dilate and supply a normal amount of blood and oxygen to the neurons. It is necessary to remove this bony cartilaginous blockage that the neck muscles have partially turned into. The temporal muscle, the levator scapulae, and other suboccipital muscles in the patient. All these muscles, especially here, there is a small thickening, a bump, but it has become smaller. It has decreased by half. Before that, it was even larger. It was protruding. A manual therapist or osteopath might say that a vertebra has shifted and needs to be adjusted. But this is not a vertebra. This is a buildup of fibrosis, collagen, calcium, collagen, and a bump has formed. But it needs to be broken down gradually, roughly speaking, like with a chisel. You gradually break it apart, little by little, little by little. The inflammatory process is initiated. Inflammation is the body's response to damage. And at this point, the immune system starts to work. The procedure ends, and the immune system comes into play. It begins to isolate this area through inflammation. Macrophages, lymphocytes, and leukocytes are activated here. Here, treatment is taking place because inflammation is always a response to damage, and the scheme is like this. Without damage, well, proper damage, large issues cannot be treated, hypoxia cannot be treated, and vision deterioration cannot be treated. You can actually even listen to how it crunches. It used to be audible, but now it is not. This may seem like some kind of cruelty, but the fact is that there are no other options. Muscles are healthy. They should be elastic, not in constant tension. When pressed, they should not cause pain. They should contract and relax, be healthy but firm. They should not be stone-like or rigid anywhere in the body. Today, we have a procedure for the neck, the cervical collar zone. I am very happy because we had a break between procedures. This is the first procedure on the neck muscles after the break, and the progress is tremendous. The fibrosis here has decreased by half, here and here. Accordingly, the patient's condition should improve. I am sure it has improved.
How is the condition after this procedure? Has improved?
Were there complaints about vision, about deterioration of vision, about something else?
Yes, it was hard to get up in the mornings due to hypoxia. How is it now? A little better.
A little better.
And more work needs to be done.
Yes, right here. I think it's perhaps tolerable. Yes. What is the task? We need to try our best until the end. This malignant solid neoplasm, which did not exist in the human body before. This formation was not present in the patient's body. It is malignant, it severely worsens the condition, it significantly deteriorates, and reduces cognitive function. It notably impairs vision, it considerably triggers tinnitus, it can initiate various psychological and mental problems, as the muscles of the neck lead to constant oxygen deprivation, and the brain cells, neurons, also suffer from starvation. And the brain is indeed the most energy-consuming organ. Neurons are similar cells, but they are healthy large cells. Simply put, neurons consume the most. That is, for example, there are heart muscle cells. Well, you can't really touch their efficiency, but in each cell there can be about 200 mitochondria, which produce energy, and the heart works with 200 or 300 mitochondria in each cell, and each mitochondrion needs oxygen and nutrition. A neuron can have 1,000 or 10,000 mitochondria, and that is why the brain is the most energy-consuming organ. And the brain consumes up to 20. Again, it may not be exact, but I think about 25% of all the oxygen we inhale. This is all the oxygen we inhale. The brain is 2% of all body mass, but it can consume approximately around 20 to 23% of the energy produced by the body. And when there are such tensions in the neck muscles for supplying oxygen, that is the most important, along with food, minerals, vitamins, nutrients, proteins, and fats. The brain suffers from starvation and its performance declines. It declines very significantly. The cells responsible for vision and hearing begin to suffer. For the production of neurotransmitters, neuropeptides, glutamine, serotonin, oxytocin, and so on, because there is a lack of building materials, a lack of fuel, and there is a blockage here. And our task is to eliminate this blockage, free the vertebral vein, ensure that the vertebral artery expands, and maximally restore a healthy state to the neck muscles. And what is that? Well, definitely not like this, not stone-like. You can already see it now. Here. It may also be heard how it crunches here. But this is not bone. This is literally muscle that is turning into bone. And dear beloved friends, indeed there is no other way. Why is it used in so few places? Because you see, this is how you need to work. Fingers are calloused, elbows are calloused. Here you go. There are no other options. If there is just stroking, if there are any needles, if there is, God forbid, a manipulation, it will be a disaster. Everything is so compressed here. Here. Both nerves and white vessels are simply compressed, constricted. You can cause a lot of harm here. This is not a vertebra. This is not a displaced atlas. Muscles simply turn into bones, and there is growth of fibrous tissue. Connective tissue begins to thicken here. Collagen, more collagen, and such lumps form. These are not vertebrae. They haven't shifted anywhere. Must not be manipulated in any case. In principle, everything has been told, everything has been shown. So in conclusion, dear friends, you had a headache for a long time. 1. If your vision starts to decline. 2. If you have ringing in your ears. 3. If you start experiencing various darkening in your eyes and fatigue, tiredness. 4. If you start to feel pain in the back of the head in the crown area. if various cluster migraines start attacking, this is not related to the weather. This all relates to the neck muscles and surrounding areas. Therefore, dear friends, look for a specialist who deals with the treatment of muscles and fascia. He can indeed be called a myotherapist, who doesn't treat pain. Neurologists and chiropractors do not treat pain. They do not treat muscles, but muscles need to be treated. An osteopath does not treat muscles. Muscles need to be treated with mechanical impact. A kinesiologist does not deal with muscle treatment. Who else? Taping does not help. Needles do not help. This is not treatment. Taping does not heal. Relaxants do not heal. What other options are there? Please suggest additional options. What else? Tractions do not heal. Adjustments and chiropractors can make things worse and can cause significant harm. They do not heal. What does heal? It is mechanical impact, and scientifically it is deep tissue therapeutic medical massage. It is also called myopressure, myofascial pressure. Our task is to crush these malignant neoplasms and initiate the process of recovery and regeneration of new healthy muscle tissues. There are no other options, dear friends, so look for specialists online using the specified terms: large trigger points, myofibrosis, myopressure, deep tissue therapeutic massage, myotherapy. If you do not find and do not start stopping the growth of fibrosis, it will spread like mold. It does not stop at just one muscle. Muscles layer upon layer lie on top of each other, and it acts like glue, sticking these muscles together. They are no longer separate. They begin to turn into a single substance. Muscles should glide, the fascia, the fascial membrane. All of this should be elastic. Everything should glide. If it continues longer, it sticks even more. More collagen is deposited there. It strengthens, and the muscles, which are different, like the strap muscle, the scapular raising muscle, the suboccipital muscles, they stick together into a single rigid structure, hard like bone. And this needs to be destroyed to free each of the muscles, to let them breathe, to let them work. This only happens this way. Just simply say that there are no other options.
Sadly, that's how it is.
What is happening here? Here we have a hot compress, therapeutic heat. One towel, and this towel I roll up and pour boiling water over it for purpose. The areas that were worked on with deep tissue therapeutic massage are being warmed up to reduce swelling, to relax the worked muscles areas so that they can be stretched now. Now there will be therapeutic stretching. It's called PR, post-isometric relaxation. We gently remove the compress. Here it is well and carefully warmed up. Now, the patient is slowly and patiently stretching well, gradually. And we gently breathe in, hold the breath, count 1, 2, 3, 4, 5, 6, exhale and stretch. We stretch on the exhale a little bit.
Is it actually okay?
Effort 1, 2, 3, 4, 5, 6, and exhale. We relax slowly and deeply. Effort 1, 2, 3, 4, 5, 6. Dear friends, if there is fibrosis in the muscles are fibrosed, they have trigger points, they are fibrosed, shortened, and if you haven't performed such a procedure and then haven't applied a hot compress. Such muscles should not be stretched. You cannot stretch in yoga, in Pilates, on your own. Will only make it worse. The muscles will not stretch. They are tight. Trigger points will not allow stretching past the fibril, and fibrosis will not allow stretching in the bundle and the muscle itself. The load will fall on the tendons to which the muscles are attached, and the muscles are attached to the tendons, and the tendons to the bones and vertebrae. Micro tears and injuries may occur at the points where the tendon attaches to the muscles and at the points where the tendon attaches to the bones. This is how the Achilles tendon tears, how the back of the thigh tears, how the muscles with trigger points and fibrosis do not tear. There are only slight tears. The main source of tension, like a bowstring, is the tendons. Muscles can and should be stretched only this way. This is therapeutic and beneficial stretching, post-isometric relaxation of the treated muscles. Remember, keep this in mind.